Dreams by King Feezer. In this video, we'll be covering sleep disorders, the treatments for those disorders, what your dreams mean, and the substance's effects on your sleep. Walt had big dreams and made them happen, so we'll explain the best way to maximize your dreams. First, we'll cover the disorders, and its clinical name, Parasomnia. The disorders I'm about to talk about are less known, and the main disorders are narcolepsy and insomnia. But these disorders, restless leg syndrome, was the inability to keep legs and arms still. Sexomnia engages sexual activity unconsciously while you sleep. Recurrent isolated sleep paralysis means that you cannot move, but you are still conscious. Shift work sleep disorder deals with changing sleep patterns because of work or different schedules, and you cannot get back on a regular sleep schedule. Rapid eye movement behavior disorder deals with acting out vivid, unpleasant dreams with vocal sounds or sudden violent arm and leg movements. Connected to disorders, we'll talk about the treatment of those disorders. The two main categories for treatments are clinical and medicinal. Clinical treatments include sleep studies taking place at hospitals using EEG machines and professionals to study how your sleep quality is. Counseling allows for professionals to reconcile with your behaviors and thoughts to help you have better and more clear sleep. Practicing good hygiene also affects your sleep positively. Minimizing distractions like TV, eating, and other activities before sleep also affect how your sleep is. Minimizing light and noise also helps sleep. Also, white noise can be beneficial too. Insomnia, one of the most prevalent sleep disorders, can be solved with melatonin and other depressants to help you sleep and retain sleep. Restless leg syndrome also is being treated by depressants, such as gabapentin, which limits your receptors. Narcolepsy is treated with stimulants to keep you awake instead of falling asleep at improper times. Changing topics to what do your dreams mean? And make sure you take this with a grain of salt because it is all hypothetical. If you find yourself falling in your sleep, it is a sign that you think that your life isn't going well. If you find yourself being publicly humiliated in your sleep, it is afraid that you are afraid of imperfections and your shortcomings. If you're losing teeth, you are worried about your attractiveness and concerned about your communication skills. If you find yourself dying in your dreams, it can reflect the anxiety or fear in your real life. If you find yourself being tested in your dreams, it might reveal underlying fears of failure. Being chased in your dreams can mean a couple different things. If you're being chased by an animal, it means you're hiding from your own anger. If you're being chased by an unknown person, it could be your childhood trauma or past traumas. And if you're being chased by the opposite sex, it means you are being haunted or you find yourself afraid of the past relationships or the opposite sex. And just like I said in the beginning, make sure you take this with a grain of salt. Because would you listen to a genie or would you take advice from the stars? Just make sure that if you're getting all this sleep and you're remembering your dreams, that just means that you're getting a good night's sleep. The last topic we'll talk about is substances' effects on your sleep. The three main categories of substances are stimulants, depressants, and hallucinogens. Stimulants increase the difficulty of falling asleep. It also decreases the quality of your sleep and the overall shorter duration of your sleep. Depressants may make you fall asleep faster and make you feel calm, but it decreases the quality of your sleep drastically. Hallucinogens also may make you feel tired or calm, but they decrease the quality of your sleep and the processes involved with your sleep. The first main substance we'll cover is alcohol. Alcohol affects your quality of sleep drastically, but it does increase your sleepiness. But it suppresses the REM cycles and makes your sleep cycles just not as good as when you don't have alcohol in your system. The table is a great visual aid to show you how alcohol affects your sleep. it shows you the deep fall into sleep, but then the offset rhythms and decreased quality. Marijuana or cannabis is our next main substance. It increases your sleepiness and calmness, but it disrupts your sleep, and it allows for non-restorative sleep. And it doesn't allow your functions to happen, like putting memory into long-term memory and other circadian rhythms. The last substance we'll be talking about is caffeine. Caffeine affects your sleep by not allowing you to go to sleep as easily, and it also reduces the satisfaction levels of your sleep that you get. So you are wasting your time by sleeping on caffeine. Using the information in this video, you should be able to get the best night's sleep possible and understand what your sleep means.